Hi folks, Dr. Greg Sanchez here with Home Instead Senior Care Pasadena and Monrovia offices. Today we are going to go ahead and have our live Facebook Live event on free, everyone loves free, right? Free professional caregiving training in our community. I think that it is pretty cool that there are a lot of programs and schools out there that a lot of people just don't take advantage of or don't know about. So what we're going to do today is talk a little bit about some of the things out there. We'll definitely touch base on the community college. We'll talk about some of the adult school programs. We'll talk about our friends at EDD, the Employment Development Department, because EDD is more than just unemployment checks, okay? So they do a lot more than just cut checks. They definitely have some resources there from a training perspective that are free to the community, and we can talk a little bit about those. And then lastly, I'm going to introduce you to another free program for California residents, which is our American Job Centers of California, which is also associated with EDD. So we'll talk a little bit about that as well, because there's a lot of interesting, really cool programs out there, and not just in home care, in several different kinds of industries, but we're going to kind of just hone in and talk about home care. But we'll be going ahead as I'm talking, we'll be posting into the chat some of these websites that you can go ahead and go to. I've tried to make sure that the link will get you directly to the home care jobs, but if you kind of look around the website, you'll be able to navigate to the other jobs that might be available. Why are we doing this? Because again, specifically as it's related to home care, the home care industry is growing at a rapid pace. We at the Home Instead offices here in Pasadena and Monrovia have 60 job openings right now, and we could hire people, that have a compassionate heart and are really looking to make a difference in the lives of seniors and special needs. There's jobs available right now. But if you are kind of hesitant about jumping into a new career, we're going to point you into the direction of these programs. The other thing that I also want to go ahead and share, especially here at Home Instead, is if you go through one of these external programs, you are looked at a little bit higher level when you're applying and you're being offered a position, meaning that you're not going to just come in at the introductory rate of $15.50. Maybe you're coming in at $16 an hour or $16.50 because you were able to go ahead and complete one of these external programs. So we're going to go ahead and start off with community colleges. So the first one is, so community colleges, everyone's familiar with Pasadena City College, Cerritos College, Mount SAC, whatever it might be. And we're all familiar with the academic component of it, which is basically, you pay based off of units. But each of those campuses also has what we call non-credit division. And in the non-credit division, they provide you with certificate programs. And a lot of the junior colleges have these non-credit division classes that you can take. Now, costs may vary. For example, some classes in the non-credit division are just the amount that we would be paying the instructor for. So you're looking at, you've probably seen non-credit catalogs come into your home, and you might see a photo class or, a craft class or, how to work social media. And those costs will range anywhere from $25 to $100 depending on the number of classes. Some of the classes, like the home care aid class, are free or they're very low introductory rates. So let's go ahead, and especially when it comes to Home Instead and senior care, there are a couple of different names out there on the catalogs in the non-credit division that you need to be thinking about. So if you do not see home care aid, which is what the state of California Department of Social Services classifies senior care as, don't be afraid, don't worry. You will also be looking for another term called personal care attendant or personal care aide. The personal care aide class is the same thing. What they do in those classes is they teach you about the fundamentals of working with seniors, and in some cases, even special needs clients. They also go into activities of daily living. So they'll teach you how to bathe. They'll bathe a client. They'll teach you how to dress a client, perform hygiene, feeding, toileting, transferring, all those things. And those are all incorporated into those classes. So not only do you get that experience of transferring or bathing clients, but you're learning the proper body mechanics of doing so. And these classes at the non-credit division are really low cost and in some instances free. Now these classes that are low cost could potentially have stipends or scholarships that you could be eligible for. And it's just something that you would ask the non-credit division before you went ahead and enrolled in one of those classes. So again, if you don't see home care aid, totally fine. Look for personal care aid or personal care attendant in that roster. For example, Mount SAC has a personal care aid class, and I believe they're currently registering. PCC has a personal care aid program. I don't think at this point they're running it just yet. I think they took a hiatus and they're going to start it again next year. But that class would also be available and free. And you would end up with a certificate that you could present to a future employer, home instead, hopefully, that would at least get you in at a higher level salary. So just something to consider, and that's where we would talk about our community colleges. So you don't have to take English, you don't have to take algebra. They do have classes that are specifically designed to support you in getting into a program that gets you into a job quickly, okay? So that's what we're talking about for the community colleges. So I'm going to talk to my producer Sam and make sure he's got that link in for Pasadena City College non-credit division, and it's all right. He's giving me the thumbs up that it's there. All right. Next topic is our local adult schools. People forget that the adult schools are there. Local to us here in the San Gabriel Valley would be the El Monte Rosemead Adult School, would be the Monrovia Adult School, and then Pasadena Unified actually also has an adult school. They don't call it that. They call it the Twilight Adult Education Program, and Sam will go ahead and put the links into all of those programs in the chat for you. Let's talk a little bit about the Monrovia Adult School. So Monrovia Adult School does have a home care aid. It is defined as home care aid. It is free. F-R-E-E. The cool thing about this program is, I'll let you in on a little secret. We're partnering with the Monrovia Adult School to go ahead and basically direct place into a caregiver position here at Home Instead Pasadena and Monrovia. I'll give you another little hint. Participants in that Monrovia Adult School could get placed at Home Instead Pasadena and Monrovia, but could also get placed at Home Instead LA, Home Instead Long Beach, Home Instead Whittier, Home Instead Rancho Cucamonga, Home Instead Downey. So there's a lot of opportunities. Now you're thinking, oh my God, you want me to drive all the way from Long Beach, that's where I live, to Monrovia? Well, the cool thing is if you participate in this free program, you only need to go to campus once, and that's just to complete the documentation and get into the orientation. So that is a really cool opportunity for any person looking to get into home care very quickly. I'll give you a little bit of background about that particular program. uh, the Monrovia Adult School worked with some local workforce programs, and I'll get a little bit into those workforce programs separately in a little bit later. And we were able to get a grant that will go ahead and not only pay for you to take 2 weeks of online training, but will also go ahead and pay for you to get all of the TB tests, first aid, fingerprinting, registration with the state of California. All that's paid for if you are eligible to participate in this program. After that, then when you go into your home instead, because as soon as you finish that 2-week class, you'll be eligible to be a home instead employee, at which point you'll go ahead and have a more rigorous on-the-job training, up to 2 weeks of paid on-the-job training, at which point then you would go ahead and work with your senior client. So that's a really great opportunity that Home Instead has worked out with the Monrovia Adult School, and I want to give big props out to the Pomona Valley American Job Center of California who helped us obtain that grant from the LA County. So great opportunity. Go ahead. You can call the Home Instead office here at Pasadena, or you can go ahead and reach out to the Monrovia Adult School directly if you're interested. And again, you only have to go to the Monrovia Adult School campus once. Everything else is done online until you go to your work site. Great opportunity. And that's the cool thing about the adult schools. Even though they may have, so if you go, let's say you looked at the El Monte Rosemead catalog, when you click on the link, there may be a price associated with that class. There are lots of grants and scholarships that are given to participants so that they don't have to pay out of pocket for these types of training. And it's not just home care. I mean, we're talking about other positions like security or the farm tech or some things like that. So you need to be aware, though, that each adult school program is unique, and they are, in different school districts, so they would have different rules. But for the most part, the types of curriculum or the things that you're going to learn are pretty much the same. So I'll give you an example. The Monrovia program is 2 weeks online, and the El Monte Rosemead program is a 9-week course. But they also offer free babysitting. So there you go. So, there are lots of perks. And why are we doing this? Because the state of California really is striving to create job opportunities. We know that in home care alone, we're going to need 600,000 new caregivers to support our seniors and our special needs populations throughout the state. So this is an industry that is recession-proof, that is pandemic-proof, that has opportunities, and is also a gateway for you to think about or potentially get some experience in healthcare and make an educated decision about whether you want to go into nursing or some other aspect of the healthcare field. So don't just think that, home care is a dead end. It's not. I mean, again, there are people who love working with seniors, and it's a calling from God from them, and they definitely take advantage of working at places like Home Instead. But there are other folks who are, and you probably, if you haven't joined our Kickstart Your Healthcare Career Through Caregiving series, you've probably seen a couple of the nurses that used to be caregivers, and how they leveraged caregiving to better set themselves up for their nursing career. I'll give you a quick story about this, is that we had a caregiver who thought that their family was pushing them to be a nurse. You got to be a nurse. You should be a nurse. Nurses make good money. Well, when push came to shove, this caregiver is like, I don't like people. I don't want to work with people. So they are doing very well in their new career in IT because they would rather work with computers than people. And that's what these types of opportunities allow you to do. They allow you to go ahead and make some educated decisions on your career path without all the costs of going to college. So this is a great opportunity for anybody to consider. So we talked about the Monrovia Adult School. We talked about the Lvn Adult School. The Pasadena Unified Twilight Adult Education Program is available. Again, those links are all on the site, all in the chat. And I don't think they have a class right now, but the instructor, I'm very familiar with the instructors both at Pasadena and Monrovia, and I can tell you that they work very hard to go ahead and find job placement post completion of their certificate programs. All right, so lots of great opportunities there. And in the catalogs for both, so the catalog for Monrovia and Pasadena Unified Adult Twilight Program, those are classified as home care aides, and then the Lvn Rosemead one is classified as a personal care aide. Again, the same thing, just different naming conventions. That's it. Okay. All right. So great opportunities out there to go ahead and get your feet wet in a new industry, that are free or extremely low cost. Great opportunity to go ahead and complete a certificate and look for look to see if you can go ahead and get beyond an entry-level pay scale. So that's great. All right, the third one that I'd like to talk to you about is the EDD. So again, everyone knows, most people know what EDD is. The acronym stands for Employment Development Department. Now, the Employment Development Department isn't just there to send out unemployment checks. A lot of people love their unemployment check, but eventually those things run out. So what EDD has done is they've created what we call here in California the American Job Center of California, the OJCC. The OJCCs are basically centers throughout the state. We've got a few of them. We've got one in East LA. We've got one in downtown. We've got one in Pomona Valley. They're all over the place. And these centers will go ahead and they have job boards, number one. But number two, they also point you in the direction of free training classes. If there's not necessarily a training class per se, they do offer on-the-job training opportunities where you are paid to work in a particular field and identify whether you would like to work in that field or not. So there's, again, lots of opportunities through the OJCCs, or the American Job Centers of California. One of the other things that we have here in LA County is the Workforce Development Program. The Workforce Development Program really is kind of an organization that helps employers find qualified individuals, or if they cannot identify qualified individuals, they help the employer create training programs, all free, so that way you can go ahead and go into those industries. So again, I've talked a lot about home care, but there are lots of different programs through these organizations that we've talked about that can help you in other career paths. So I would definitely share this information with family and friends who are questioning, hey, you know what, I've been out of work from the pandemic. I used to work in the food industry. I don't know if I want to go working back in a restaurant or not. I don't want to be around all those people, and they're kind of questioning, what do they want to do? Well, push them to this video so that they can learn about some of these resources within our community that can help them that are low cost or free training opportunities that will help them get better in their new career or their prospective career. So I'm going to take a moment here for a second and ask Sam, do we have any questions?
Yes, you have a lot.
All right, so Sam's going to go ahead and read off some questions for me.
So the first one is from Nina Ramirez. I'm a medical assistant and I'm doing my externship. Can I still do this program?
Absolutely. So it depends on which program you're talking about. So if you're talking about the program specifically from the partnership between the Monrovia Adult School and Home Instead, yes, you can, because again, the training program is done online, and you can set your hours in which to complete that online training. At which point you'll then start working immediately. The thing you need to ask yourself is, you're working on your medical assisting right now. That's a clinical role, but there's also administrative work. So it's a great opportunity to go ahead and get some well-rounded experience in a medical office. But it really doesn't allot you a lot of time to go ahead and get that one-on-one interaction with your patients. Whereas in home care, that's all you do. You're doing one-on-one interactions. You're going ahead and you're assisting with activities of daily living. You're going ahead and doing, helping that senior stay independent in their home longer. Not to mention, if you're concerned about being around too many people, especially even though we're at the end of COVID, you don't want to really work in an environment where you're around a bunch of people. One-on-one care works out really nice because you're just going to one person's home and then that's it. So something to consider. You're absolutely eligible to do so. Participate. So I would go ahead and click on one of those links so you can learn some more information on it. Thank you.
One of the next is, what is the highest education needed in order to join the program?
There is 0 education requirement, okay? I don't even believe that you need a high school diploma at this point. There is an age requirement. There is I would definitely follow up with the Monrovia Adult School in general, in specifically, so that way you can get some more information on that. But my understanding is there is no education requirement for this program.
How long would it take if I were to complete and to be hired here at home?
Okay, so if we're still talking about the program from the Monrovia Adult School, literally it is, so we'll walk you through the process. So you go ahead, you reach out to the Monrovia Adult School, they do a pre-screening. In essence, we are going to interview you before you even get into the program. Once you've gone through that screening and you meet the criteria, then they would schedule you with a Home Instead office that's closest to you for a face-to-face interview. If that face-to-face interview goes well, they're going to go ahead and push you through to that program. You'll schedule your orientation with the Monrovia Adult School, at which point they'll tell you how to log on to your classes. They'll go ahead and get you live scan fingerprinted. If you don't have a TB test, they'll go ahead and get your TB test all scheduled and set up. And then you take your class. The class is, I believe, 80 hours, at which point you complete that 80 hours. I mean, technically, if you did it, if you thought about it as work and you did it like 8 hours a day, you'd be finished in 2 weeks and you could be in an in-person orientation program in 2 weeks. So literally, it really depends on you. The sooner you can complete that online training, the faster you'll be able to go ahead and get into a Home Instead position.
Is it only online, or could I be in person as well?
Unfortunately, right now, because of COVID, the program is only online. And the cool thing about how the program is designed right now is that there's a cohort every week. It's cohort meaning class. So if there is if you actually have an in-person, then that limits you to the start times. So there is discussion that we would be looking to go ahead and start an in-person class in the summer. So, but just to let you know, again, once you complete your book work online, you have in-person training here at the Home Instead office, where not only are you going to get our orientation, but you're going to have a day of how do I transfer? How do I use a Hoyer lift? How do I give a bed bath? How do I go ahead and change sheets while the patient is in it? All those skill sets that you need, you're going to get taught through this program. Once you have that, then there's a whole day and a half of Alzheimer's and dementia training to help you understand how to work with an Alzheimer's patient. Lastly, is especially in this program, you have shadowing shifts. So there will be shifts where you are working with a caregiver one-on-one with one client to go ahead and get the feel of it. And then after that, you're going to be on your own, but you're going to have a mentor who's going to be checking in on you on a regular basis to make sure you're doing well. That is how this program between Monrovia Adult School and Home Instead has been set up.
Another one would be the legal status, if he's not a legal migrant here, would he still be able to apply?
Unfortunately, for this program, no, but that does not limit you from participating in other adult school programs. And the reason why it limits you based off of your status is the fact that you need to be able to complete an I-9 form, and you need to actually have a social security number in order to go ahead and have a FBI DOJ background check. That is the requirements to be a home care aide in the state of California. But there are other programs through these various resources that I've talked about that you might be eligible for and not need to have an immigration status assigned to you.
Gonzalez is just asking, I want to avail any program that fits for me. How can I avail them? Avail means take advantage.
You can take advantage of any of these. I mean, literally, you are 2 clicks away. If you're looking, and again, I've set up these links that you can go to the general page. Some of them are specific to home care, but as I said, if you just look around that web page, you'll find the other programs that may be more of interest to you. And they point out, how is it free? Is it cost? And I'm going to tell you, though, the majority of these programs, even though they have an associated fee, there are scholarship or grant opportunities, just like the one we have here for this home care program through Home Instead in the Monrovia Adult School. So the question that I would ask is, go on the website, take a look and find out what program you would be interested in, and then give them a call and ask them, hey, you know what, I'm really interested in participating in this automotive program. I see that it has a $2,000 tuition. Do you have any program, grant, or scholarship programs that I might be eligible for? Because I can't afford that. And the cool thing about these adult school programs is that those counselors will help you identify what financial aid you may be able to qualify for.
And then from Tiva is asking, I am an LVN wanting to get into working for myself. Can this program help?
Actually, unfortunately, no, because again, if you're already an LVN, you're already, I mean, these programs are for entry-level individuals, not for licensed medical providers. If you're I guess the question for you would be, what is it that you'd like to be doing on your own? There are lots of opportunities for LVNs to go out on their own, to work with nurse registries. There are even opportunities for LVNs to work in home care as what we call client care coordinators, who will go ahead and manage the cases of the seniors that we work with. So LVNs, you know, you guys are awesome because you basically can go any direction you want. We had an LVN as a client care coordinator for many years, and she decided she wanted to move more into a clinical space. And that was before COVID. I should probably call her and see how she's doing now, post-COVID. But yeah, unfortunately, this program won't benefit you. But ultimately, there are different avenues that you can take as an LVN that will definitely go ahead and provide you with a little bit more perspective outside of the clinic.
From Yolanda is, I'm a caregiver with a IHSS.
Yes.
Do I have an opportunity here?
Absolutely you do. So IHSS, for those of you who don't know, is in-home support services. Now, in our state of California, we have Medicare, Medi-Cal. Medi-Cal is our low-income support system for individuals who need health insurance. Medi-Cal recipients are eligible for in-home support services, IHSS. Anyone who's on Medicare is basically has too high of an income, which is crazy, but that's a story for a different day. And they don't qualify for in-home support services. As an in-home support services caregiver, you are absolutely eligible to participate in one of these programs. I would just go ahead and take a look at those links and give it a try. So absolutely.
Another one would, do you require to have the COVID vaccine to be hired?
No, actually we don't. But you know, there will come a time, and I'm suspecting that when the when the Pfizer vaccine has gotten its full approval from the FDA, a lot of employers will push for that. What we do is we don't require it, but we strongly encourage it. But what we do is we here at home instead have you on a testing regimen. So you basically get tested on a regular basis, so that way we can ensure the clients that you work with that you have a negative status. But I think, and we also work with the regional centers who support our developmentally disabled communities. And I was just on a call the other day where the Inland Regional Center is looking to go ahead and make vaccination mandatory. A lot of the congregate living facilities locally are moving to require vaccination for all of their employees. I think it's a matter of time, but at this point in time, it does not limit you from getting a position.
Multiple questions are talking about, I live in South Central. Would I need to go to Monrovia every day? I'm interested in that school though. And also they're asking, would it just be only online? So maybe if you can rerun.
Oh, absolutely. I think that's a great question. Thank you for asking it. So this Monrovia Adult School program, if you are eligible and if you qualify, you only have to go to the campus in Monrovia once. That is to complete the orientation so you can get an understanding of how the online system works. And then the class is all online. Okay, so all online. So you don't have to, you have to go to Monrovia at least once, okay, for the orientation. And then that's it. At which point, if you are successfully participating in that training program and then work with Home Instead, you would be working at the local Home Instead branch. Within South Central, there's one in Culver City, Inglewood. There's another one in South Bay. There's one in downtown LA. So those are a lot closer than having to drive all the way over here to Pasadena. But I think for the most part, to answer your question, one time to the Monrovia campus, and the rest of it's all online.
When you get hired at Home Instead, is it full-time or part-time? How will the scheduling go? Would that be at night or in the morning?
It's up to you. So if we think about so the question was about how does scheduling work? So let's be honest. We are working with the elderly population, and some of our clients fall out of scope or they pass away. So we're not classifying our caregiving staff as full-time or part-time. You're classified as variable hour employees. So how we work it here at Home Instead is you tell us what is your availability. I am available to work Monday through Friday from 7 a.m. to 7 p.m. Now, granted, that doesn't mean you're going to be working 12-hour days, but you're giving them a window of opportunity. and then they place you with a client within that window of opportunity. If you only want 20 hours a week, well, then they're only going to schedule you 20 hours a week. If you want 40 hours a week, they're going to schedule you 40 hours a week within that window. I will let you know that here at Home Instead Pasadena and Monrovia, we require all caregivers to at least work one weekend day, or provide us with an availability on one weekend day. So either Saturday or Sunday, it's going to either be in an 8-hour window that you can work. That is a requirement that we have. But most of our caregivers, if they have their desired hours, the number of hours they want to work per week, and then they have their availability. And some caregivers work the night shift. They work graveyard, 11 p.m. to 7 a.m. the next day. Some caregivers work in a window from 3 p.m. to 7 p.m. Some work from 3 to 11, all over the place. Because if you think about it, we're there to support our seniors to maintain their independence in their home. So we want them to have the availability, the care when they need it. And we're trying to honor what you guys want, which is that usually I want to work X number of hours a week, and I want to try to work within this window. But for our offices here in Pasadena and Monrovia, there is a requirement for a weekend day. And weekends are great. I mean, I personally enjoy having days off during the week because no one's around. I can go to the grocery store pretty quick, do what I need to do. If I had kids, I could go ahead and take them to school, maybe even pick them up, and then, have a nice day with them. So it really just depends on you. But that's kind of scheduling. So variable hour employees, again, totally up to you on the number of hours you want to work and the timing you want to work.
So another question from Miss Lau. I am a CNA. Do I have an opportunity at this company?
You have more. Oh my gosh, there's a CNA, absolutely. CNA, which stands for Certified Nursing Assistant, is a certification that goes through the Department of Public Health. Now, CNAs tend to work in facilities or like skilled nursing or at a retirement community, and they have a tough time. I really respect our CNAs because they're working with 6 to 12 patients or clients or residents a day. They don't have one-on-one interaction. CNAs love to work in home care because it's literally one-to-one. You have one person that you work with. Let's go ahead and make sure that we understand that. So you say you want 40 hours a week. Okay, well, you have a client who only wants 30 hours, so you work with them for 30 hours, and then you maybe have a second client, but you're only working with them one-on-one. So that really helps. Now, some CNAs are making $17 an hour. And you know what? That's great that you are able to make that much money, but again, remember, you are working with 8 to 12 patients at one time. We usually pay our CNAs at a starting rate at about $16 an hour, and then it goes up from there, depending on the level of care. But for the most part, yeah, think about it. Okay, is it worth the extra dollar an hour or $8 a day to work with 12 people? Or is it better that I just have, I'm not making an additional $8 a day and I'm only working with one-on-one? It's really about your peace of mind.
Another one would be I have an ITIN number. Would the program be available for me?
ITIN.
Undocumented person.
Oh, okay. So unfortunately, no, because again, you would need to go ahead and pass. And again, this is the Department of Social Services requirement to be a home care aide in the state of California. You need to be able to go ahead and complete an FBI DOJ background check. So that won't work. Now, we do have DACA recipients that are eligible because they do have the work, in essence, the work visa to work here. And we do have a few caregivers who are DACA recipients, and that hasn't been an issue, and they've been able to clear through the background checks.
Another one would be from Tiva. How can I get into client care coordinator at Home Instead?
Oh my gosh, that's great. Yeah, client care coordination is really about case management. So our office hires gerontologists, so folks with masters in gerontology. We do have a couple of client care coordinators that do not have that higher level of education, and there are lots of different home instead franchise offices throughout the LA area. There are 17 home instead franchises within the LA basin, and some of them are looking for individuals who have experience working with seniors, who understand, changes in condition, individuals who can write plans of care. So those are the opportunities that are out there. And if you're interested in learning more about client care, at our next week's Kickstart Your Healthcare Career Through Caregiving, you're going to meet Christine Strong, who is one of our client care coordinators, who started off as a caregiver and has taken classes in behavioral management and is now the client care coordinator for our developmental disabled clients. So come in and watch our Facebook Live next week. Is it 4 p.m.? 4 p.m. next Thursday for your Kickstart Your Healthcare Career Through Caregiving, where Chris Strong will talk to you about her client care experience.
This one's a kind of a bundle of questions. What are the benefits of working at home instead, and what training do you guys offer? First aid, AED, what is so perfect about home instead?
All right, so Home Instead Pasadena, Monrovia offers, so we have full benefits. So you, after 90 days, you get your health, you have access to health insurance through Kaiser Permanente, dental, vision, 401k after 6 months of being here, 1 week paid vacation after being here for a year, sick time, COVID sick time, all different types of incentives. Right now, we're actually celebrating Caregiver Appreciation Week, so we have lots of different programs going on for that. We just had a meditation class for our caregivers who are interested in participating. We're going to do that every 2 weeks. So those are the kinds of benefits that we offer our caregivers here at Home Instead. We also offer support in the field. A lot of home care companies don't have lead caregivers or case managers or safety ambassadors. We do. So if you're in the field and you are like, oh my gosh, my client's, I'm seeing my client decline, and she really, I'm struggling getting her into the shower. You can work with your client care coordinator to have a lead caregiver join you, and it doesn't cost the client anything to have that support while you're bathing the client. So those are the kinds of things that we offer that make us different, is because we really focus on the safety of our caregivers and our clients. Now, with respect to training, we have both online training as well as in-house trainings. Today was a training extravaganza. Today we had caring for diabetes clients. We had a Parkinson's class. We had a Hoyer lift training class. All of these are in-person classes, and of course they're all paid, including your online classes are paid. All of these things are available to you when we have a training coordinator who has all this set up. And if for some reason you have a unique circumstance with a particular client, we send the trainer to you. So that way they can work with you one-on-one in the home of the client in question. So that, you want to know what makes Home Instead different? Home Instead Pasadena and Monrovia are different because when we talk about, to us it's personal, we mean it. And we respect, we honor, and we cherish our caregivers here. We do our best to make sure that we give the hours they want, and we try to take good care of them. And in return, our caregivers take good care of our clients. So that's what makes us different.
Perfect. And then a couple questions are, with the online classes, are they scheduled, or you can access them at any time?
Access them anytime you need to. So if you're working right now in a job that you're really not happy with, you can go ahead and participate in this program if you meet the eligibility requirements, and still be able to work until you can transition over and start working at Home Instead, and then you can quit your other job. But yes, there are no, you have assignments that are due at certain times, but that's really about it.
Perfect. And then let's see. A couple people are asking where the pay ranging or the starting pay for Home Instead.
So starting pay for an individual who really doesn't have a lot of home care experience. Here at Homestead, Pasadena, and Monrovia is $15.50 an hour. Okay, so that's our starting salary here at Homestead, and then it just goes up from there. So ranging and people ask all the time, how do you go ahead and pay your caregivers? Well, we're paying them by the level, their experience, and the level of care that we're providing. So if you're just doing what we call companionship, and you're a level 1 caregiver coming in, you're going to be making $15.50 an hour because you're just driving that senior around. You're really not having, you're helping them wash dishes, you're keeping them engaged, you're working with them to keep them mentally stimulated, but you don't have to bathe them, you don't have to dress them, you don't have to feed them. By feeding, I mean like with the spoon. So that's where we go. Then we have what's called personal care, where we talk about the activities of daily living, where you're helping someone take a shower, where you're helping someone go to the restroom, where you're helping them, eat. That's what we classify as personal care, and that increases your salary rate. And then we have specialized care. So if you have Alzheimer's and dementia experience, or Parkinson's experience, or experience with people with substance abuse, then you get a higher salary from there. So it's tiered in that regard, and then it's based off of your experience and your level of background.
And then a lot of questions about Monrovia. If you can just walk through again from Monrovia of how it goes.
Oh, okay. So, all right. So for that Monrovia Homestead program, you click on one of those links. You click on that Monrovia link. You call and speak to the Monrovia Adult School and say, hey, I want to participate in the home care aid program with Homestead. They will go ahead and phone screen you right there. They're going to ask you some specific questions. If you meet the criteria of those questions, then they're going to go ahead and send you to your local Homestead office and schedule you an in-person interview. You will then meet with the Homestead HR team at your local franchise office, at which point you are, you're basically going to get hired. And if you are hired, then we send your information back to the Monrovia Adult School. They schedule you for your orientation, 1-day orientation on campus, teach you get you your fingerprinting, your TB, getting all your registration, online registration for the Home Care Bureau. They're teaching you how to go ahead and log on to the online learning system, and then you're done. You do those classes on your own. Again, it's 80 hours worth of training. You try to get, if you could probably get them done in 2 weeks if you wanted to, at which point you would then, once you've successfully completed that, then you're scheduled to come into the Homestead orientation, at which point you are then placed into an on-the-job training program where you will be taking additional hands-on classes on all those activities of daily living we talked about, Alzheimer's and dementia, and then you'll be shadowing a seasoned caregiver for a few shifts, so then that way you feel comfortable and then they'll go ahead and go on your own. But you're never alone, because you will have a mentor who you can reach out to and talk to about any of your challenges. You have an office staff to support you, case managers, lead caregivers, all that stuff for you. So really, if we think about it, if you started this process tomorrow and you were screened and then interviewed by Homestead, you could be in orientation at Monrovia Adult School by next Thursday. 2 weeks from there, so by the first week of June, you could be joining the Homestead team. So that's how simple it is. And a lot of folks, it's really about, what do you want to get out of this program? For me, it's getting people educated on home care. It's getting, people jobs with benefits. And it's getting our seniors and our special needs clients the care that they need.
Perfect. One final question is,
sure,
just if I were to be hired at Homestead, Would I have to be coming into the homestead office, or would I be going around to each client?
You would be, so the only time you usually come to the homestead office is when you're going through your onboarding, so you're hiring, for training, like orientation or various other classes, and then that's it. And then if you needed to come in for supplies, or you needed to come in for a talk with human resources or with one of the case managers, that's really the only times. Most of the times your shifts or your scheduled time at work would be at the client's home. Now, we service clients wherever they reside. So if they reside in a private residence, whether that be an apartment, a senior apartment, or just their own home, their private home, or if they live in a senior community, that's the location where they reside, and that would be your work site.
Someone asked, as a CNA, do I have to still go through the home care training, or can I apply directly?
You can apply directly with Home Instead. You do not have to go through the home care training. So CNAs out there, if you're tired of working with 12 clients or 12 residents, if you're tired of going ahead and not being able to make a connection with your resident because you've got to shower Miss Jones, then get Mr. Smith to the bathroom, then feed Mrs. Alexander, and so on and so forth. And if you're tired of that, and if you're tired of working in facilities, consider one-on-one care.
Tell them click the link below.
Click the link below. That's what I would tell you. You are definitely welcome to work in home care. You would be an asset, and you would be greatly appreciated.
Perfect. Let's see.
Is that it?
Final question.
Final question. Here we go.
Let's see. Just someone threw out there. Are you paid per client or per hour? Can you reiterate on?
Oh, absolutely. So you're paid per hour. So you make an hourly wage. Okay. So but the hourly wage will adjust based off of the level of care you're providing. So level 1 caregiver coming in making $15.50 an hour. Okay, you're going to go run errands. You're going to, make a sandwich for your client. You're going to make sure that their bed is made. You're going to help straighten up the dishes because, again, remember, seniors may have neuropathy or something that makes it hard for them to grasp things. You're there to make sure that nothing's on the floor that would cause them to trip. Okay, so that's companionship care. Maybe you're playing a game or, watching a movie together, whatever it might be. Personal care, you're making a little bit more. Why? Because you're going ahead and you're performing those activities of daily living. You're assisting with bathing, dressing, feeding, those kinds of things. The other the next level of pay increase for a level 1 caregiver would go to the specialized care, an individual who is able to work with someone with developmental disabilities or even Alzheimer's and dementia. So that is the level. So you're paid by the hour, and your pay will shift based off of the level of care you provide. All employees have access to our health care benefits program, to 401k with a 4% match, paid vacation after working here for a year, COVID sick pay, regular sick pay, and tons of different incentives.
That's it. If you want to finalize it, you can
all right.
Pasadena number.
All right. Well, I want to thank everyone for listening in today. It has been my honor to sit here and share with you some of the great free and low-cost training opportunities to become a professional caregiver or just a professional in general, or getting into those entry-level positions without spending a fortune going to college. Those things are available to us through some great programs. If you came in late, you can go to Rewind, and we talked about a few of them just to summarize: community college, non-credit division. We talked about the local adult school programs, the EDD programs, the American Job Center for California. All these things are available to you, and there's free money out there, folks. Take advantage of it. Don't get scared by seeing, oh my God, this class is going to cost me $2,000. There are funds out there. Don't be afraid to ask what stipends or grants or scholarships you might be eligible for. Take advantage of it. With that, I wish you a great evening. Thank you so much. This is Dr. Greg Sanchez with Home Instead Senior Care of Pasadena and Monrovia. Our phone number, if you're interested, is 626-486-0800. And Monrovia's number is 626-471-3035. Have a great evening, and we'll talk soon. Take care.